If there's a particular situation scenario that returns or keeps reoccurring or lasts a long time and you just can't get it off your mind, you don't know what to do, you've tried things, I would say definitely pick up the phone.
Welcome back to another episode of Busy People Getting Fit. Today, we're diving into a topic that affects all of us, mental health. Whether it's managing stress, improving relationships, or understanding our emotions better, prioritizing mental well-being is just as important as physical fitness. And to help us navigate this conversation, I'm honored to have an incredible guest joining us today. Melissa Gray is a highly respected licensed psychotherapist and the founder of 𝐬𝐭 Counseling with degrees from the University of Texas at Austin and Texas A&M. Melissa has dedicated her career to helping people improve their mental health through evidence-based therapy. She holds multiple certifications, including licensed clinical social worker, ADHD certified clinical services provider, certified social worker in healthcare, and clinical social worker in gerontology. Her expertise spans a wide range of major health concerns, including ADHD, anxiety, depression, relationship challenges, self-esteem, and more. Melissa, welcome to the show.
Well, thank you, Bryan. I appreciate it.
I'm so glad you're here. Yeah, lot to get out. And just so you know, I try to be transparent with everyone. You're my across the street neighbor, so we are kind of like staring. I'm staring at you right now, just across the way.
Yeah, that's kind of creepy, but okay.
So let's just dive right into it. Super simple question: do I need therapy?
Yes, you do. I've been meaning to tell you that.
Yeah.
Okay. So are you saying if somebody's asking that question?
Yeah, I mean, people have clicked on the thumbnail because the question is, do I need therapy? Okay. Right. So that's the question. Or when do I need therapy?
Okay. That's a great question. A lot of people wonder that, right? And a lot of people ask me that, do I need therapy? And a lot of people also just want to talk about things. I would say that it just depends on the individual and their circumstances. But if somebody is really pondering an idea and concerned about something, that's probably a good sign that maybe they might want to pick up the phone and call and talk to the therapist and see if they need to make an appointment or get some feedback on that. Let's say, for example, that somebody has a problem, they're thinking about it and just kind of don't know what to do. Maybe they read a book or an article or do some internet search, or maybe they listen to your podcast.
Yeah.
And they're just not finding the right answers, or maybe they're afraid to talk to people, their friends and family, because they're afraid maybe they'll be judged or that information will get out there, and they're just kind of concerned about talking about their problems. Those are all situations where it'd be appropriate to contact a therapist. I would say lots of times people don't contact a therapist simply because they don't understand what it is. And there's lots of myths and misconceptions about therapy, and that kind of holds people back.
Okay.
Yeah.
So what is a myth that you want to debunk that you hear a lot of the time, but that's stopping people from seeking therapy, even when they would be a good candidate and that to take it on?
Again, I think a lot of people just don't understand what it's about.
Okay.
I think a lot of people might think, okay, so if I go to a therapist, I'm going to be lying on a couch. I'm going to be talking about my childhood, the very first memories going forward, right? And it's going to take years and years and lots of money. And so they're like, no, I don't want to do that.
Okay.
I'm sure some therapists might still kind of use that technique, and it's a valuable one in certain situations. But there are so many different theories and practices that therapists use these days that are shorter term, more specific to a particular problem that somebody may come. It's called a presenting problem. And it's completely different than lying on the couch and the therapist barely saying anything and saying, so how does that make you feel? Things have changed. Again, not to say that doesn't happen anymore. It just depends on the individual. There's lots of other things that people misconstrue about therapy, like they don't have time or the research sources or the transportation or childcare. That's changed because telemedicine is so popular now.
Okay.
People can slip away at work 45 minutes and have a session.
Okay.
They can even go out to their
car.
And
when you say have a session, you mean call you, FaceTime you, video conference, however that works.
Exactly. So I have a very secure system. It's through Simple Practice, and it is kind of like what we're doing now, where we can see each other, hear each other.
Okay.
It's proven to be just as effective as in-person therapy. They've done research on it. And it's just so much easier for people to get help. For example, if they were in a rural area and not able to find somebody, a professional that they felt comfortable with, they can hop on telemedicine, or maybe that specialty, a therapist that provides that specialty is not nearby. They can hop on telemedicine. So it's much easier these days for people to find the care that they want or need.
Okay. So the people that I talk to, I think a lot of our listeners, they probably fall into a couple of buckets when they're considering whether or not they need therapy. One bucket is dealing with family issues, whether that's dealing with their parents or siblings, and dealing with siblings and how to take care of parents, or they have kids. It could be younger kids, kind of not super young, but junior high, high school, how to deal with them, and then also, a marriage situation. At what point, if I've got family issues, at what point do you think it'd be useful to reach out to a therapist?
If there's a particular situation scenario that returns or keeps reoccurring or lasts a long time and you just can't get it off your mind, you don't know what to do, you've tried things, I would say definitely pick up the phone. Personally, I do a complimentary 15 minutes where people can call me and we can kind of discuss it and see if that's something that they need to come in with. Basically, therapy is just listening, providing unbiased feedback, teaching people skills, and helping them problem solve. So if there's something on somebody's mind and they just can't seem to find a solution and they've done whatever they feel comfortable doing, I would ask them why they wouldn't contact a therapist, because that's what we do. We help people figure out solutions.
Okay. So, and you mentioned tools.
Yes.
So these are tools, these are frameworks, because I'm assuming if I go into therapy, the last thing I want is for you to say, tell me more, tell me more, tell me more. And then we leave with me having done a lot of talking. I already talked to myself plenty in my head. Right. And then the second thing I don't want is for you to be a know-it-all and tell me exactly what to do because you're the expert. Right. So where in the middle of all that?
That's a great question, right? Okay. So my goal as a therapist is to help you learn the tools to take and then use. So it's like you're coming and you're getting an investment in your future problem solving skills, right? So the tools are like coping skills. And I've kind of got a toolbox of coping skills and techniques to teach people. I am trying to empower you to solve your own problems. I'm not going to tell you what to do. I'm trying to gather information, provide you with the skills, allow you to make your own choices, because I don't want to create a situation where somebody becomes dependent on a therapist, right? This is to empower my clients. So I kind of just educate them. First, listen to the problem and kind of help them figure out exactly what's going on and what they want to solve, and then provide specific tools. A tool might be thinking about the way that they're interpreting events that are going on and helping them to reframe that, but teaching them that skill. So when that same subconscious thought reoccurs, they can catch it, reframe it, and ultimately feel better. Does that make sense?
Okay. The other kind of category that I think a lot of our listeners fall into is overwhelm. The reality is, we live in a neighborhood, we live in kind of a society, a generation, I don't know, but we are more stressed out than any other generation out there. And we're trying to live life to the fullest, right? Yeah. We're trying to be perfect parents. We're trying to be perfect spouses. Yeah. We're trying to go on perfect vacations, live in the perfect house, have the perfect dog, read the perfect things, be grateful in the perfect way, treat people perfectly. And eventually, I can't sleep at night because,
that's a lot of perfect.
Because there's one area of my life or maybe two are falling apart, right? Or it just feels like, and I can't sleep. I'm anxious. There's a lot of stress. It turns out, Melissa, I'm not perfect. And that's really stressing me out.
Yeah. Well, who is, right? Like, if you keep striving to be perfect, that's going to drive you crazy. So what's your question? Like how not to,
what's the question? Yeah, great. The question is that I assume therapy would be helpful in a situation like that. How would therapy help me in a situation like that?
Okay. So in a situation like this, the striving for perfectionism, what we would work on is, fully assessing the situation and where this comes from, but it doesn't have to take years to do that. We kind of figure out what the trigger is and why you feel the need to be perfect all the time, because that's a very, very high standard and lots of pressure to put on yourself. And then if you're feeling that way, it might leak over to family members, right? So that would be a very difficult situation. We would talk about, of course, relaxation techniques, but catching those thoughts that you're telling yourself automatically that have been ingrained in your subconscious and catching those, pulling them out, catching them, paying attention to them, reframing them. That's cognitive behavioral cognitive behavioral techniques where we get those cognitive distortions and reframe them. And teach you that tool though, so that as you're telling yourself that, you stop, do your relaxation, deep breathing exercises or whatnot that we've practiced and reframe it. And it's amazing with practice how more efficient and automatic that can become, so that really those statements and that pressure that you're putting on yourself is more likely to just kind of subside. It takes a little time, but once you learn these tools, it's something that you can then take and continue to practice on your own.
Okay.
You follow me on that?
Yeah.
Okay. Of course, the exercise releases a lot of that tension and stress at the same time. So there's other relaxation techniques and taking good care of yourself that we would talk about as well. But that internal pressure and those internal things that you're telling yourself, those standards that you're trying to meet, and we would really dissect that and work on that and learn tools to address that.
Okay. My next question I recognize is going to be tailored to the individual and the situation.
Yes.
But just at a high level, once I start therapy, is this something I have to do twice a week, an hour every time for the rest of my life? Is this, and we talk about exercise. You need to exercise every day, right? You need to lift heavy 3 days a week. You need to get up and move multiple times an hour. Where does therapy fit in?
With that specific regimen?
Yeah. Well, I mean, again, is this every week, forever?
Okay.
Is it, so if I go and see, so for example, there's some body work specialists, so some chiropractors who honestly, their whole goal is to make money off of you. So they'll set you up an hour a week for every week until you cancel, right? And then I have another who I recommend people go to. His goal is to not see you after 3 sessions. He wants to work on you and teach you things you can do at home, give you plenty of homework. So he doesn't see you after 3 sessions. So where does that fit in? Okay.
So every therapist is different. So how I do things is, all of my clients start with that complimentary 15 minutes because that's a required part of my practice. I want to be able to talk to a potential client, answer their questions. The two of us communicate. I want to know what they're looking for, answer their questions again, because it's very important to me that somebody that's coming to me has already been able to communicate with me, get their questions answered, because I understand it's an investment. It's a financial investment. It's an emotional investment, time commitment, all of that. So once that is done, once we both decided, because it's a choice that the client makes, once we both decided, hey, yeah, we think this is going to be a potential good working relationship, we schedule that intake appointment. That intake appointment is the longest appointment. That's where I really gather the information about that client, because my treatments are specialized for every client. Okay. So we gather the information. After that appointment, that's when I make a treatment plan. And what I do is have their goals, the objectives that we set, and then the potential interventions that I'm going to provide. Then I present it to the client, and then we kind of tweak it because, again, I empower them. It's their choice. It's their treatment. We discuss it. We talk about how often do they want to come. And then I give my recommendations as well. And it's kind of a mutual communication about their treatment, because I am not going to tell somebody, you are required to come every week or twice a week for the, next 2 years, because number one, I don't know. It depends on the client and the situation, how hard they're willing to work. I do ask that they do homework in between sessions. Okay. If they don't want to do it, that's up to them. But the more that they are working on the skills that we are discussing in sessions and practicing those, the more efficient the treatment is going to be. If they're resistant, we're going to talk about that and try to process that. But if they're resistant, that's part of probably why they're there. But we're going to work on that, and it does draw out the treatment longer. But again, that's the client's choice. And I can't require people to come a certain amount of time. I can give my recommendations, but my goal is to make them self-sufficient, help them learn tools that then they take and apply in their everyday lives. And, they go on their merry way. So I don't just keep people, I know it happens, but I don't keep people coming just to have a paycheck. That just kills me. That's not me.
Yeah. Switching gears just a little bit. What is the connection between mental health and physical health?
Yes. Oh my goodness. They are completely intertwined. If one area like mental health is suffering, physical health is going to suffer and vice versa. They're just completely intertwined. That's why if you go to a physical more and more or take a child to the annual checkup, they're asking the mental health questions because the medical community has learned that they are so intertwined. So if you think about it, if you're depressed, sad, or stressed or angry, fearful, whatever, different emotions are going to release different chemicals in your body. And that's going to cause different behaviors, different health situations like high blood pressure. It goes all the way to like hair and skin changes, and vice versa. If you work out, that releases chemicals, that, and helps you feel a certain way, relieve stress, more energy, whatnot. And it can improve your physical health, we know, of course, but they're completely intertwined.
Okay.
Yeah, that's why it's important to take care of both.
Yeah. So, I'm a big proponent of moving every hour, lifting heavy weights 3 times a week, getting our heart rate. We should be out of breath, ideally, like every day. Like we should do something every day to get out of breath. I recognize not a piece of you're like, that's crazy, But let's say 5 times a week that we should be have worked physically hard enough to be out of breath. To get that. That's how we get endorphins, right? That's how getting out of breath, working so hard with our cardiovascular system, but also lifting heavy. That also releases endorphins, and those are the feel good chemicals that you were talking about.
Yes, and serotonin. Yeah,
awesome. Okay, so I like to kind of wrap up our conversations with, what one thing, because everyone wants to know what's the one thing, and you're like, well, actually, there are like 30 things. I understand that. If you can give our listeners one thing to take away, one action that they can do after listening to this, what action would that be?
If they're struggling with their mental health, I would say, honestly, go to my website, pick up the phone, schedule an appointment. We can even do the telehealth 15 minutes. Yep. Again, it's complimentary. Ask me questions. I don't mind. That's what I'm here for. And if I don't feel like we're a good match, like maybe it's not my specialty that you're discussing, I am more than happy to provide referrals to people.
Yeah.
Or maybe we talk and it's like, hey, maybe you just need to go exercise. It could be something simple like that. If somebody's really struggling, it may not be that simple, but I'm just saying there's no reason to not reach out and talk to a professional, talk to a mental health professional, talk to your doctor, ask some questions. That would honestly be my suggestion.
Okay. So what I'm hearing is that if someone's listening to this and they're going, I think I should just go to your website or go to another therapist's website and book. Would you say most therapists offer a free consultation, or is that so let me give you some perspective. At my gym, to join my gym, we sit down and we talk for about 30 minutes to make sure we're a good fit. My personal recommendation is don't join a gym that doesn't require this 30-minute conversation, because otherwise they just want your money and you don't know what else they can provide. They don't know if you're a good fit. You don't so to me, it's a red flag when all you can do is push a button on the website and now you're a member. Is that similar?
So I can't speak for other therapists, but I did recently call around trying to make a good connection for a friend who needed a certain situation to speak with somebody. And was kind of trying to make some connections to help. And I was surprised because I was like, well, can this person call and speak with the therapist? And like, well, I was talking to the receptionist, and this happened a few different times. I know that some do provide it for sure. I think it's becoming more popular. I don't get, because again, that first intake appointment is usually the longest appointment.
Okay.
So I don't think it's right really to expect somebody I think you need to have that communication so that you kind of get a feel on both ends, the client and the therapist, if it's a good match or not.
Yeah. Yeah.
I would suggest that people make sure that happens.
Okay.
Yeah.
Perfect. Well, thank you, Melissa. Really appreciate it.
Thank you.
How can our listeners best reach you?
Go to my website, 𝐾𝐨𝐿counseling.com, and there's a contact form, or you can shoot me an email or set up that 15-minute consultation and complimentary. All of that is right there on the contact page of my website.
Perfect. Okay. Well, thank you very much. I appreciate the conversation. I've learned a ton. I hope others have learned a ton as well.
I do want to add, they could go to my social media through the website as well. I've got free tips on there too.
Okay. Where can they reach you on social media?
I've got the links on the website. That's probably the easiest way to do that.
Perfect. Awesome. Well, thank you. And I will put links to your website in the show notes.
Great.
I'm
Thank
pointing
you.
down because that's where the show notes are going to be.
Okay, great.
And
Awesome.
people can just click on that. Awesome.
Okay.
Okay. Well, thank you,
Paul.
Melissa. I appreciate your time.
Thank you.
Have a great day.
All right. You too. Bye-bye.
Bye.